Ultrasonic sound cannot be seen, heard, or felt. To demonstrate the effectiveness of an ultrasonic dental cleaning system, we have designed this simple experiment. We have used an Emmi-dental ultrasonic toothbrush, real extracted human teeth arranged in dental modeling wax, carved to detail oral anatomy. To best replicate the chemistry of plaque which builds up around the teeth in the mouth, we used dental opaque porcelain powder mixed in a dental modeling fluid, which, when left to dry, sets to a firmness similar to plaque in the mouth. This is the creamy white granular substance you see around the teeth on the model. Dental opaque porcelain like plaque is granular and does not dissolve in water. The Emmi-dental ultrasonic toothbrush is pre-positioned inside a square plastic jar filled with water. The dental model was stuck to a clear acrylic tube, weighted for stability. When the ultrasonic toothbrush is turned on, the ultrasonic sound waves generate millions of microscopic bubbles that implode in the water, especially between the grains of the opaque dental porcelain. This is exactly how the ultrasonic waves break down plaque to a micro level in the mouth over a period of time through regular use of the toothbrush.